Statistik 2018 menunjukkan kelahiran bayi di Malaysia adalah sejumlah 508,685 dengan catatan satu bayi setiap 1 minit. Ini menunjukkan betapa kritikalnya para pakar obstetrik dan gynaecology yang juga dikenali sebagai pakar sakit puan. Obstetrik dan gynaecology adalah pengkhususan perubatan surgery yang menguruskan kesihatan pembiakan dan organ wanita. Obstetrik berkaitan dengan penjagaan proses kehamilan, manakala gynaecology berkaitan dengan sebarang penyakit yang berkaitan dengan organ-organ pembiakan wanita. Sejajar dengan tajuk Bual R&D pada episod kali ini, iaitu Research and Development in Obstetrics and Gynaecology, kita membawa pakar ONG dari Sarawak General Hospital, Dr Voon Hian Yan. Thank you for coming today, Dr. Voon, to the studio.
Thanks for having me. Terima kasih. Nama berita?
Very good, yeah. Okay. We understand that there are so many specialists in the hospital. What made you interested in choosing ONG as your career?
That's an interesting question. In fact, I commonly ask that question to my juniors as well. I think one of two reasons. I got exposed to obstetrics and gynecology very early. When we were studying in the 3rd year of medical school, we had a very good mentor. He would keep asking us questions, why are you doing this?
Yeah.
Do you think the women actually needs oxygen? Okay, so he sparks the questions in your mind rather than always doing things because that's what you're told. So you start thinking why and why and why. I think eventually that connects towards my eventual interest in research as well. And secondly, obstetrics, apart from gynecology, obstetrics is my main focus of interest. Which other field do you actually see good outcomes most of the time? Yeah? Healthy women coming in, going out feeling good about themselves, wonderful beginnings, the joy of childbirth. So it's very rewarding in some cases, not always, but most of the time it's a rewarding part of the occupation.
So you are very, what we call that, important in the woman's life as well. Background of your career in ONG at the Sarawak General Hospital, you are also adjunct lecturer in University Malaysia Sarawak. Apart from that, you are also a researcher yourself. As a doctor, you must be very busy. How do you actually manage your time?
Well, I think I'm very blessed because my wife, who's also a medical doctor, she's quite supportive. And we also have both our parents as well who help us out. And on top of that, the Department of ONG in Sarawak General Hospital in Unimas, they are also very encouraging. And we can't do this without everyone's help, including our colleagues.
Exactly. So everybody is actually
giving
you a moral support.
Yeah, they all play a part, taking away. We all only have 24 hours, don't we? Yeah. Exactly. So everybody kind of shares and takes a bit of the responsibility.
Exactly. Okay, our topic for today is very interesting one, yeah? Research and development in ONG. So probably you can elaborate more on our topic as you are the specialist here.
So it's very interesting. I think as a clinician, you cannot just do your part in seeing patients, in treating them, but you always have to have an additional question in your mind when patients are not getting better. Kita pun tertanya-tanya, kenapa masih tidak ada nampak perkembangan yang positif pada pesakit ini, walaupun kita telah memberi rawatan. So that's where research comes in. You need to look up why. Am I treating her in the right manner? Is there any other forms of treatment which will make her better? So I think overall, that's very important. We cannot be too restricted to our normal duties, okay? Because research tells us the answer. Research tells us, does this medication apply to this population? And our population is very diverse, different ethnicities. What works in another population might not apply to ours. So that's why it's really important.
Okay, but you're also looking at some of the research sample from the overseas, right?
Yep, we are.
In doing your, in terms of you wanted to doing your research further in your particular area.
Yeah, we do. So the reference would come from countries which have already established certain papers, and sometimes we collaborate with them. Okay. We'll go to the examples later.
Yeah, exactly. So what are I understand that you have a few projects in the pipeline, but what are the current projects that you have?
So one of the main projects that we're doing now is called PragMind COVID, PREG as in pregnancy, mind as in the mind.
Mm-hmm.
So this research is an international collaboration. I think there are more than 15, 20 countries involved from South America, Poland, Hong Kong, Australia as well. So it's an online study whereby we have just managed to get ethical approval from the National Medical Research Register. So we're going to start it kicking soon, and we've translated it to a Bahasa Malaysia version. If any one of you are interested, you're most welcome to scan the QR code, which we'll include later, hopefully. So it looks at the risk factors. We know COVID has changed everything. Okay, I might be exaggerated, but everything has changed from the way we study, from the way we approach our friends, no more hugging. So this study actually looks at how women are affected by COVID in terms of their attitudes towards seeking healthcare services, their concern in pregnancy, and it incorporates two important questionnaires. One is to look at their signs and symptoms of depression. Another one is anxiety. All right. So in a way, it's helpful because it also highlights our need to recognize the importance of mental health in women. Kesehatan mental sangat penting.
It's very tremendously, what we call it, high, the risk right now.
Yeah, it is.
So apart from you face to face with your what we call that, the women that come to the clinic, do you do as well an online consultation? So
there is we are trying to work on a project called Baby Baru. So Baby Baru is an automated chatbot. Yeah. So we're trying to use artificial intelligence to answer relatively minor complaints amongst women, and we've actually submitted this for Tegas. We were the top 3 for the Tegas is by the Sarawak Multimedia Authority. We're the top 3 finalists, and also made it to the top 5 of the recent National ONG conference. Okay, so what happens is women say if you're pregnant, you're really worried, you have a bit of bleeding, you're 18 weeks pregnant, everything else was okay, but you don't know. Who are you going to ask? Are you going to ask your friend? Are you going to ask, your mom who was pregnant 20, 30 years ago? Or are you going to take that small risk of going to the hospital for something which you think it's going to be okay? So this is where it comes in. Yeah, we're not taking in all those serious complaints, but mild complaints that women have a concern that need to be addressed, and hopefully they can allay their anxiety. Right. So this one all about AI. They were answering the questions, right? Yeah.
We'll get more information about this. Kita berehat seketika. Kita kembali lagi ke studio bersama Dr. Voon Hian Yan. Okay, just now we're talking about the projects that you have.
Yeah.
What about the financial resources, funding or grants that you get for the project?
So generally, researchers are divided into investigator-initiated. That means that the researcher is interested. He tries to find his own funding, or industry-sponsored researchers, whereby money is usually not a problem because big drug companies are involved. They want to test out the drugs, and you are just there to help them to collect more information and be involved in the analysis. So most of my papers, unfortunately, are researcher, investigator initiated. Yeah? So there are several sources of funding. We are quite lucky that in our department, we have the Postgraduate Society of ONG, Persatuan Postgraduate Obstetrics and Gynaecology Sarawak, who provide some form of support. Nationally, there's also the Ministry of Health grant. And also there are other grants available which you have to apply. I think Sarawak we're quite lucky. We have the Sarawak Research and Development Council. So there's some grants available there as well.
Okay, that's good. Initiative from all the authorities, governments, and so forth. Yeah. What are the impacts of your of this R&D projects towards the social economy of Sarawak?
So one of the previous studies which we have just completed is looking at preeclampsia. Okay, preeclampsia sejenis penyakit darah tinggi yang cuma berlaku waktu mengandung. Dan tekanan darah tinggi ini ada yang boleh dirawat dengan ubat dan baby boleh mencapai usia yang baik, yang cukup bulan. Tetapi segelintir kecil begitu serius sehingga baby terpaksa dilahirkan awal, which leads to prematurity. These babies are born 800 grams, 1 kilo, and they end up having to stay a long time in NICU. Yeah? So one of the papers that we look at is how risk factors perform versus a more detailed screening. Risk factors means if I look at you, puan usia 40 tahun, pernah ada darah tinggi sebelum mengandung, so risiko kamu tinggi, you are high risk. So we start you on a prevention called aspirin, all right? But my paper has shown that despite just using these risk factors, it fails to identify almost 40-50% of women who will eventually develop preeclampsia. So what we need to do actually is not just looking at these risk factors, bukan saja pada faktor risiko, tetapi juga mengambil parameter-parameter lain, seperti uterine artery Dopplers. That's the type of scan that we do. We look at the blood vessel that supplies the uterus. So if the resistance is high and your blood pressure when we see you is already more on the higher side, we put this together in a mathematical formula and we'll say that, you know, you are actually high risk, we might have missed you otherwise by screening.
Yeah, so this is some of the limitations.
Yes.
But what are the other challenges that you also face?
In terms of research?
Yeah, correct.
That's a very good question. So research in women who are pregnant is especially difficult because two lives are involved. Correct. And women are especially careful when they are pregnant. And it doesn't apply to all, but when you talk about things which are research in nature, people will start thinking, are you making me a guinea pig? Adakah saya bahan eksperimen? Yeah. So that's the first question, the patient's perception and how they are more cautious with that. And additional challenges would be funding, of course, and staffing. I'll give you one example. In one of the clinical trials that we try to put up, the trial insurance alone costs more than 50,000 ringgit. So it's quite a big hindrance. So unless we get a major grant, it'll be very difficult to proceed.
I see. So these are some of the challenges and limitations. What is your suggestion? How do we overcome this? By having more grants?
That would be nice if it's possible. If any of our ministers and decision makers are looking at it. So I think also the research has to matter. Yeah. If you're looking at things which are preventable, which are serious, like preterm labor, yeah. So there has to be more funding to support these initiatives. And if you're looking at things like mental health, yeah, 5% of women end up with postpartum depression. Yeah, 50% have some form of baby blues, but they get better. But 5% go into postpartum depression, who might require medication, and a small proportion of them might even have suicidal ideation. Yeah, so having enough research into mental health, how it affects women, including the PregMind COVID trial, is really important.
So interesting. Kita bersama lagi dengan Dr. Voon. Kita berehat sebentar. Kita kembali lagi ke studio bersama Dr. Voon. Okay, but talking about your project just now, yeah. But you have been involved in many of the conferences, and one of the congress that you involved in the 27th International Congress of ONG Society of Malaysia. So apart from your involvement, do you publish papers and also articles?
So I was quite lucky to be part of the scientific committee that organized the National ONG Conference last year. I was also asked to chair the Maternal Fetal Medicine Pre-Congress. So we met a lot of people from overseas. That's pre-COVID, of course. And I actually learned a lot as well organizing that. On top of that, I do have several publications in both local and international journals, various topics, including the use of antibiotics as a prophylaxis in a condition we call ragged membrane. You know how sometimes after women have delivered, lepas bersalin, temunik atau uri, keluar sepenuhnya, tapi kadang-kadang terdapat cebisan-cebisan yang kecil. And di Sarawak, some of our women stay very far away. So we're worried about whether there's a residual risk of infection. Yeah? So for many years, we've been giving antibiotics to these women until the paper which I have done with my colleagues show that actually there's not much difference. So they do not require that prolonged duration of antibiotics. And we've since stopped that practice.
Okay, so that is your current paper?
That was back in 2019.
All
yeah.
Right. Okay. So the achievement so far in the national or international level?
So I'm quite blessed and fortunate. I've received 2 Young Gynaecologist Awards. First in 2017, which was an international award from one of the companies.
Right.
And the second one was in 2019, just last year, November, in Manila. So it's called the Young Gynaecologist Award. It's given to one candidate from each country from the Asia Oceania Federation of ONG. So we have the Congress every 2 years, and each country, there are about 30, if I'm not mistaken, selects a representative to go. So they look at several criteria. You have to be less than 40 years of age. I hope I'm not revealing too much with my silver hair. And also they look at the papers that you have. And I'm quite proud to say that one of the papers that we presented there actually won 2nd place during the Congress. And in the recent first virtual ONG conference this year, one of my papers also managed to get the first prize. It was a video presentation on preeclampsia.
But you yourself still look very young. That's why you...
Looks can be deceiving.
That's why you received the awards. So today is about our topic on the R&D on ONG as in your career area, right? So probably you can conclude the whole topic for today.
Well, I think it's a good topic that you've picked, because research is important. Without research, we can't answer clinical questions. We don't know why we are doing what we are doing. It's something that we are doing actually causing more harm than benefit. And that's where research comes in. It's a special place. Of course, it has to be validated over different populations, different countries, and then we'll move forward and make women's health much better.
Helping the community as well, right? Especially in the rural area. I really envy you, Dr. Voon, as a medical doctor, as an adjunct lecturer, as a researcher. You are also writing, You are doing a lot of write-up, articles, and been chosen as one of the what we call it, awards of the young. What again just now?
Young Gynaecologist Award.
Right.
We are here because of the opportunities given to us by other people. Yeah.
Exactly. And the most important thing is that you are helping the community. So in terms of your career path, you are actually helping them. I'm so happy to see you here today as helping the community, especially the women out there. So where have you, I understand that you've been in Kapit before.
Yes.
Boleh bercakap Iban?
Boleh mimit.
So in Kapit area, you are the MO there, right?
Yeah, I was a MO in hospital Kapit. Even back then, I was interested in obstetrics. So I was there from 2010 to 2012. And the interesting thing is I still tell people, back then before the Bakun Dam opened, I could still take the express boat all the way past the Pelagus Rapids to the Bakun Dam. And we have been on helicopters many times.
Interesting journey. How's the women at the rural area compared to the Kuching area?
The women there require more help, more assistance, but they are really, really tough. I remember on my 3rd day, we had an obstetric emergency, on my 3rd day there, and my 3rd day as a MO, whereby the woman's womb, lepas bersalin, the sarang anak terbalik. Okay, so she came in on a 5-hour boat ride from one of the KKs, escorted by, there are no doctors, just paramedics. She came in with a HB, a hemoglobin of 3. Your HB is about 12. She survived that journey, and she lived. I don't think any city folk would have survived that.
Oh my goodness.
The women are really tough.
Really challenge for them as well, right? So I believe that there will be more people out there that need your help in the ONG area. Thank you, Dr. Voon, so much to be with us here.
Thank you for having me.
Okay, begitulah besarnya tanggungjawab pakar ONG bagi membantu penurunan statistik kadar kematian kelahiran bayi yang mencatatkan 5.4% dari setiap 1,000 kelahiran dan penurunan kadar kematian ibu bersalin iaitu nisbah 25 bagi setiap 100,000 kelahiran baru. Kita telah pun mengakhiri episod kita pada kali ini. Saya Qistina Donna Lee Abdullah memohon untuk mengundur diri. Assalamualaikum dan salam hormat.
Gynaecologist.